Hello, everyone, and welcome to another edition of your Rehab Power Hour. This is your community to engage in virtual rehab together and a place to discuss all things neuro-rehab, from the science, the people behind it, and the individual journeys of recovery. I'm your host, Dr. Nick Housley. Thanks so much for being here with me on this lovely day. Really quickly, I'm going to go to my first guest on the Rehab Power Hour today, and we have Charlie on the Rehab Power Hour. Charlie, welcome.
Thank you.
Yeah, so Charlie, if you wouldn't mind, just start by giving me a quick introduction to who you are and where you're calling from.
I'm calling from Alexandria, Virginia. My mother had recently had a stroke, so she's was in some acute rehabs and is now in subacute rehab. So she's being evaluated. We'll know more what her condition is on Thursday, but I know she had some left side weakness on her leg, has some pretty severe weakness on her left arm. So we were just looking at potential methods to help her recover.
Sure. Yeah. So thanks for the background. So it's really good. I want to give you a lot of praise and acknowledgement for doing your due diligence and trying to find strategies and advocate for your mom. I think that is a huge factor. Not everyone has that. And so she's very fortunate to have you in her side of the ring, I guess. So that's really good. And I think you guys are also in a really good position in terms of the timing, right? We know that there's a lot of factors that dictate sort of the rate of recovery and sort of those long-term outcomes. And time is one of them, right? In terms of getting rehab options open and available and scheduled as soon as possible can really, really help. The other thing that's really interesting too is you guys are, coming to these solutions kind of before most individuals do, in terms of being still inpatient, and you're kind of making those steps to find the best paths forward in that transition period to the home. And that, from my perspective, and I might even ask Dr. Wolf's perspective on this as well, that's a critical juncture in the path of recovery, right? You find yourself in a really, really intensively monitored period where you have medical staff, rehab staff, nursing staff there to help you do basically anything you need. They're there to monitor and help guide you through all of your rehab. And if you find yourself in a really good rehab facility, you're able to really capitalize on that, getting as many as 3 hours of rehab a day. And then when you contrast that, what happens after a discharge from one of those facilities, even the subacute rehab facilities, you may find yourself getting, at best, maybe a couple hours of rehab a week. So that is a big drop off, and it's a big change in the support structure. So I think it's really good that you're trying to figure out solutions that can help sort of ease that transition period.